Welcome to Dr. Confidential. Today we're going to be talking about the 4 stages of menopause. If you like this, please like and subscribe below. Now, you might have heard that menopause happens and all of a sudden one day you don't have hormones and you get all these symptoms, right? That's what I thought many years ago. Even as a medical student, we don't learn much about menopause. I didn't know that there's all these stages like a pre-menopause and a post-menopause and a perimenopause. All of these things were very new to me. First, let's talk about what happens before all of the menopausal symptoms happen. It's called premenopause. That's basically your life before all these hormonal symptoms happen. Now remember that premenopause is before any of these symptoms started, so it's basically from the time you get your period to the time you first start experiencing symptoms of perimenopause or menopause, which is the next stage. Perimenopause is this long period where you may feel vaginal dryness, you may feel itching, you may feel weight gain in certain areas, fatigue, brain fog. These are typical signs and symptoms of perimenopause. And guess what? Perimenopause can start up to 10 years before the average age of menopause, which is 50 years or 51 years. So you start getting perimenopause symptoms around the age of 40, maybe mid-40s. Some people that get menopause earlier, their perimenopausal symptoms can start in the 30s. So perimenopause can be 10 years long, and it can be long and full of symptoms that are really hard to differentiate between, thyroid issues, between high blood pressure, high cholesterol. So this is why I think it's important for people in perimenopause. Women in perimenopause should get their labs checked. I think often if you're experiencing symptoms that are very confusing, it's very hard to know where they're coming from. So for example, I'm in perimenopause and I wanted to know what is going on inside my body. So I use a company called LIFEFORCE that comes to my house. We get a blood panel every quarter. I get to talk to an expert about my labs and optimize my inner kind of workings. Now, you don't need a hormonal blood test to diagnose perimenopause or menopause, but it's good to take a look inside the hood, as I think of it, to see what's going on, especially if you're having symptoms with brain fog and fatigue and insomnia, bloating, fat around the midsection, all of the things that could be perimenopause, but also could be other things. In fact, anxiety can be a thyroid disorder. It's not necessarily perimenopause. You want to make sure that you're checking everything else, your vitamin D status, your magnesium levels. These are all things that can be found if you check your blood test. So perimenopause is probably the most troublesome time because it's a long period of time. Your hormones are fluctuating all over the place, which is why you're getting a lot of these symptoms. All right, third stage is menopause. Now, menopause is the time where basically you've stopped having your period for 12 months. So if you've not had a period for 12 months, basically that's a diagnosis of menopause. You don't necessarily need any other kind of diagnosis to do this. Now, if you're confused, if there's lots of different issues going on, this is also another time that you can use LIFEFORCE or another blood testing or a medical company or a doctor to look into what's going on. But the definition is 12 months without a period. This is the time to really optimize your health. You may want to opt for hormone therapy. That's something that LIFEFORCE helps with as well. You can optimize your nutrition and just help your hormones that way. You don't necessarily, not everyone needs to be on hormonal therapy. It does help with certain things like hot flashes, which is a hallmark of menopause. It also helps with certain other symptoms that you might be getting, especially like pain, vaginal dryness, and other types of symptoms during menopause. Menopause can be a very frustrating time for a lot of women because there's so many weird symptoms like ear itching and hives and anxiety and sleeplessness, all caused by the loss of hormones. Estrogen and progesterone are hormones that really help you with so many different parts of your body. And so menopause can be very frustrating because as your estrogen and progesterone goes down, you may notice dryness of the skin, you may notice fatigue. These are all things that can happen during menopause. But the good news is you can do a lot through diet, through exercise, through sleep, through supplements, and through hormonal therapy to help this. The last stage of menopause is postmenopause. This is when your body kind of gets used to less hormones. So in a few years after menopause, you get into this postmenopausal state. This is the time that you may be wanting to check closer on your bone health, on your brain health, again, looking into your labs, but making sure that your cholesterol is not getting out of control. Postmenopause can be a good time for people because it's like the body has settled in, has kind of gotten used to the lower levels of hormones, and it's kind of the baseline state that you will be in for the rest of your life. So this is just a very condensed version of what happens in the 4 stages of menopause, but I hope that brought you some clarity. Basic things are improve your diet to support these hormonal changes. Make sure you're moving a lot, getting a ton of sunshine and sleep. Make sure you look under the hood, as I call it. Get a company like LifeForce, look into your lab work with a practitioner on getting the right foods and supplements, hormones if necessary, medications to optimize your experience. I'm Dr. Amy Shah, and thank you for joining me. It's Dr. Confidential.